The forceful techniques, the time constraints, the system doesn't like to accept the idea that what they're doing may not be in the best interests of mothers and babies. It was when I started my own midwifery and breastfeeding practice that I became very aware of complications experienced by women discharged from hospitals that I was not observing with women who gave birth at home. It raised the question for me, why was this happening? This became the basis of my PhD research. If I could sum up all of my research, it's this. It all comes back to the first breastfeed. And that's why I refer to this as the 3 golden hours. Your healthy baby needs to feed leisurely for about 2 to 3 hours after birth. Anything that intervenes, interrupts, or delays those golden hours increases the risk of painful nipple trauma, which damages the physical and emotional well-being of the mother and her baby. The challenge for many women is having to conform to the system. For example, in my research, the commonly taught forceful cross-cradle technique is ineffective, outdated, and closely associated with painful nipple trauma. For many women, complications are avoidable. 3 main factors undermine a woman's opportunity to achieve the 3 golden hours. The first is unnecessary interventions, often starting with the recommendation to induce labour. This can lead to a cascade of intervention involving accelerated labour and administering synthetic drugs. This increases the risk of caesarean section. Of course, it's important to recognise that there will be valid reasons where intervention is necessary. Secondly, the practice of unnecessary routine procedures separating a mother from her baby, such as weighing, checking and injecting the healthy newborn soon after birth, are non-urgent procedures. All of these things can wait. You might be advised that the policy says, we need to do this. However, if your labour and your birth were uncomplicated and your baby's APGAR score is 7 or above, then your baby belongs in your arms. Your aim is to protect those 3 golden hours from routine procedures and becoming a victim of the system. Finally, the system is not geared to accommodate you during the 3 golden hours. If you are not informed and prepared with a plan for the hospital staff to understand your requirements, it is more likely that you will encounter complications. I'm often asked why the Thompson Method online course was created, not just for mothers, but also for my professional colleagues. The answer is that I was overwhelmed by the amount of misinformation that taught forceful techniques. I've spent so many years helping women overcome these painful complications. And I realised the best way to inform women was during pregnancy so that they could avoid these problems. My observations are that many women gain their information from well-meaning friends, family, some health professionals, but most concerning is the questionable free information obtained online. Current mainstream information can be confusing, conflicting, outdated, and often continues to recommend forceful techniques that are associated with painful nipple trauma, the number 1 reason why women give up breastfeeding. Before I leave Mother Earth, I'm on a mission to improve global breastfeeding rates. I would like you to be informed so that you can aim to have a natural birth and pain-free breastfeeding experience. The Thompson Method online course was designed to help you understand the concept of the 3 golden hours and to provide information aiming to reduce unnecessary intervention during labour, avoiding routine procedures that separate you from your baby, and to provide you with comprehensive planning wherever you choose to give birth, including a planned or emergency caesarean section. I will share my specific method for a gentle approach to breastfeeding. You'll learn how your baby will instinctively make its way to your breast and how to create the time and the space for this to happen. You'll also discover how to avoid the commonly taught forceful techniques that have been closely associated with painful nipple trauma. My online course is the most comprehensive program available where you'll learn the Thompson Method, whatever your unique circumstances are, for example, large breasts, flat or inverted nipples, breast surgery, and much more is covered in my program. If you've already given birth and you're experiencing pain, low or high milk volume, a crying, unsettled baby, if you're concerned about tongue or lip ties, this program will also be beneficial. We also offer a no questions asked 14-day money-back guarantee. I believe this will work for you like it has for women all around the world, and I hope your birth and your 3 golden hours are a magical experience. I'm Dr. Robin. I feel privileged to be able to share this information with you. And please remember, it's your body and your baby.